Hi there, I'm Dr. Ahmad from Juvida Clinics. In this talk, we're going to be discussing the aftercare and sort of what to expect after a transplant. So if you're thinking about a transplant, I'm sure one of the things you're asking about was how will I feel after the transplant, what things might happen, what do I need to be looking out for, and what have you. So in this talk, we're going to go through a few things in terms of what to expect in the days leading after the procedure. So the first thing that lots of people ask about or worry about is pain. So yes, there may be a little bit of discomfort post-transplant, but the good news is, number one, it's pretty short-lived, and number two, it tends not to be too bad. So the pain will be more sort of mild, bit of a sore head, mild to moderate discomfort. It's not going to be severe headaches. It's not going to be excruciating pain. Okay, so you don't need to worry too much about the discomfort. We're talking about short-lived and mild to moderate discomfort. So in terms of days, normally people describe a bit of a sore head for the first sort of 2 to 3 days. Sometimes, rarely, it might go on for about a week or so. Very rarely will it ever go beyond sort of 7 days of discomfort. So short-lived and mild to moderate discomfort. So here at Juvida, we normally just send people home with simple pain relief, something like paracetamol, sometimes ibuprofen, so something like that, just a lot of paracetamol. And it's just an as needed, as required basis. So we wouldn't suggest that you take 2 paracetamols every, sort of 4 hours or 6 hours or anything like that. It's just as required. So we would send you home with a little bit of pain relief and you just take it if you felt like you needed it. So that's pain. The next thing that people sometimes worry about is bleeding. So after a transplant, you might get a little bit of bleeding, but you shouldn't really see it. The reason why is because we place a dressing to the back of the head, front or the top, wherever you've had the grafts in. There shouldn't be any oozing or bleeding from there because the little incisions that we make are blocked by a graft. So the only place where you might get a little bit of oozing or bleeding is going to be the back of the head, the donor area, where we get the grafts from. But as I said, we place a dressing, what we call a pressure dressing, to the donor area. So that essentially will apply pressure to the back of the head. That dressing is then held in place with some bandaging that will come around the front, and you keep that dressing on for 24 hours. The reason you keep the dressing on for 24 hours is because most bleeding will occur in the first 24 hours. So by the time you removed your dressing after 24 hours, you shouldn't really see any bleeding or anything beyond that. Sometimes you may, unlikely, but you may see a tiny little bit of oozing, and if that were to happen, well, we normally send you home with a little bit of gauze in case you needed it. You can just apply a little bit of gauze to the back of the head if it's oozing a little bit, but most of the time it's very rare that you'll ever need that because the bleeding will have come and gone within 24 hours whilst you've got your dressing on, so you don't really need to worry too much about bleeding. The next thing sometimes people worry about with any procedure, there's always that risk of infection. The risk of infection is very minimal in hair transplant surgery, so it's not normally something that we're overly concerned about, but of course we do take measures in order to reduce any risk of infection. So that's using sort of what we call aseptic techniques in medicine. So basically, everything that we use is sterile. We have a clean field in which we work within. We use gloves and what have you to reduce any risk of infection. The other thing that we also do is that we apply a little bit of antiseptic cream to the donor area before we apply the dressing. And once you've removed the dressing after 24 hours, we also encourage you to reapply some of that antiseptic cream to the donor area just on the back there for the next few nights in order to make sure that we're keeping things nice and clean, again, to prevent any risk of infection. So that's pain, we've talked about, and bleeding and infection. So what else might you expect? I guess the one thing that people most notice or often call us about is the swelling, okay? So with any hair transplant, you're always gonna get swelling to the forehead area, okay? So when you go home on the day, the swelling will be noticeable, but also it's also worth bearing in mind that that swelling often gets worse before it gets better. So if you've had the procedure on one day, by day 3, by day 4, the swelling, the edema we call it, is probably gonna be more noticeable across the front there. The good news is the swelling will subside. It does go away, and normally within about 7 days or so. But as I say, it's always worth remembering that the swelling often gets worse, and because of gravity, the edema, the fluid, often shifts downwards. So sometimes it can come as low as the eyes, and in rare instances, it can also cause a little bit of bruising around the eyes as well, but you don't see that very often. So how do we manage the swelling? Well, there's a couple of things you can do. First thing we normally suggest is to apply an ice pack. As with anywhere where there's swelling, an ice pack can be helpful. How you do that? Well, get a bag of peas, get a bag of ice, something along those lines. We Don't apply that directly to the skin. You'd have to maybe wrap it up in a tea towel or something. You're then going to apply that ice pack to the forehead, which is where the swelling is. Never apply it to the graft, so just on the forehead. And would expect you to apply that ice pack for about 20 minutes or so. You wouldn't just put it on and leave it there. So 20 minutes of an ice pack, but you can always reapply and put that on a few times a day. And the second thing is we normally send people home with a short course of some medications. So this is something called prednisolone. It's a type of steroid and it works very well to reduce the edema, the swelling, the fluid that accumulates in the forehead. So if you have 1 week's course of medication, that tends to work quite well to reduce that swelling. And I guess the other thing that's worth mentioning is the scabs that form. So that's the other thing that you might that you will see post-transplant. It's very normal to get the scabs as part of the healing process. You get scabs both in the donor area and in the front. One thing that we do advise is we send patients home with a saline spray. So it's a little spray which just pumps out a little bit of salty water. And we normally suggest that you use that every hour or so for the first couple of days. And that saline spray, one thing it does is reduce the amount of scabs that form in the first place. Even with that though, you will see some scabs forming around both the donor area and the recipient site. And the reason for that is, well, look, it's part of the healing process. Whenever you have a cut or a graze, often there is, some scabs that form afterwards. And on the day of your transplant, we always spend some time going through all of these things I've gone through today. And one of the things we'll discuss is how to manage those scabs. So we normally suggest that you just avoid doing anything in that first 1 week. But after a week, when you're shampooing the graft, you can ever so lightly apply a tiny little bit of pressure to massage those scabs with a little bit of shampoo, because that acts almost like a lubricant, and that can help ease those grafts away, particularly when you're washing it with some water. So there is a way of trying to remove those scabs, and normally within 2 weeks, sometimes up to 3 weeks, those scabs should have all fallen off and gone away. So they're the key things and considerations, things to be thinking about and what to expect post-transplant. So pain, manageable, short-lived, and just amenable to very simple pain relief. Bleeding, not really too much of a consideration because we manage it with a dressing for the first 24 hours. A bit of swelling, we can use ice packs and we send you home with some medication. The fourth thing that we mentioned was the scabs. Again, we try and reduce it with a saline spray, but they will go with a little bit of time. And the other one was infection, very low risk, but we try and mitigate that risk by using some antiseptic cream. And hopefully that's been a helpful sort of overview of what to expect. No one should really avoid having a transplant because they're worried about the sort of after effects. I think the key thing to take away is that actually, although it might be a long day having a hair transplant, it's not overly invasive. We're not cutting through organs and things like that. It's a superficial procedure done under local anaesthetic, so it has very, very little downtime. You're up and about the next day, but of course there are some sort of effects to be aware of, just so you're well prepared for when you go for your surgery.